Welcome to this podcast of Super Special Kids and Cake.
Yes, cake!
I'm Granny Rhea.
And I'm Auntie Donia.
This podcast is brought to you by our book, Let's Talk, Navigating Communication Services and Supports for Your Young Child with Autism, published by Paul H. Brooks and available from Amazon.com.
As you know, every week we introduce a super special topic. These topics concern things that excite or aggravate us about trends in the field of special education. We may have some ideas that others don't always agree with, but we really do enjoy discussing them.
Welcome to today's podcast. I'm Granny Rhea.
And I'm Auntie Donia.
And we're here to talk about super special kids and cake.
Yeah. Cake.
As you know, in every episode, we introduce a super special topic. These topics concern things that excite or are of interest to us about trends in the field of pediatric communication disorders and how families can best help their children.
Our super special topic of today is, how do I know if my toddler who is not talking is autistic?
What a wonderful question, Auntie Donia. It's a really tough one to answer, and it requires actually a lot of expertise. Many parents whose toddlers don't start talking or who seem to be learning to talk slowly do worry that their child might have autism, but it's not always the case. There's certain characteristics that go along with autism that are different from those that are seen in children who are just late to start talking. Some of them, for example, include unusual sensory interests, such as liking to stretch rubber bands or liking to wave your hand in front of your eyes or liking to rock back and forth. Others have to do with a sense of a great need for rigidity and control. And so if a child is trying to build a block tower and it falls over before he's finished, the child might go into a serious tantrum. Other things that are characteristic of autism that we don't see in children who are just late to talk are a certain aloofness, a reduced interest in other people or in other children that make the child sometimes prefer to be alone rather than being with others. Do you have any other characteristics you want to add, Auntie Donia?
Well, I think when it can be difficult is around the age of 18 months to 24 months. Children are not necessarily using that much language. And I wanted to share an example of a little one that I saw at the airport. And he was 18 months and he was playing with another child that was sort of waiting in line to board the plane, but he was showing him his toy. So he didn't have a lot of language, but there was a social interest. He was showing. He was also looking towards his parents to check that that was okay as well. So he had what we refer to as joint attention, where he sort of will look at somebody else and then look at the toy. So there becomes a non-verbal communication connection. And I think that's often what we don't see when we're looking or working with children who are autistic or even who are undergoing kind of a diagnosis of autism.
That's a great point, because some of the things that point us in the direction of autism are things the child does, but other things are things the child doesn't do. For example, sometimes children who are autistic don't answer to their name, even though other toddlers who may not be talking will still turn around when you call their name. So it's a mixture of things that the child does and the things that the child doesn't do. Now, for children who are simply late talkers and don't have autism, we also see some particular characteristics. Sometimes they don't make a lot of sounds at all, and they don't make a lot of different sounds. So while typical 18-month-olds do a lot of babbling, and they do what we call jargon babbling, which means they're talking it, and it sounds as if you just can't understand the words. So you hear things like, so there's just this sense the child is talking the way other people talk, but just doesn't know what words go in there. And we see that very often in kids who are, I'm sorry, we see a lack of that in kids who are late to start talking, whereas we see it in normally developing children. So there are some different things that we can look for, both that the child does and the child doesn't do, that might tip us in one direction or the other. But let's go to our super special question for today, Auntie Donia. What is it?
Our super special question for today is, what is the difference between a child who is autistic and one who is a late talker or late to learn language?
And that is the main question we've been talking about. So I guess one thing we'd want to say is that if you're worried about that, you should definitely try to get some help to get an answer. Now, in the U.S., any child who's under the age of 3 is entitled to an assessment if anyone suspects that they might have some sort of special educational need. So you can go to your local school system, and they can point you to places that will do a really detailed assessment, much more than you would get in just the doctor's office. What are things like in the UK, Auntie Donia?
So unfortunately, not quite as positive. So we do have the NICE guidelines, which if a family is concerned that they may have a child who's autistic, they will get referred to for an assessment. And under the NICE guidelines, it has to be more than one professional that does the assessment. And the gold standard would be using the ADOS as well as an interview, which we refer to as the ADIR. I think the challenge is that we do have long waiting lists. And so if a family is suspecting that you have a toddler, and from what we've shared with you today, you're suspecting they may be autistic, then definitely going to your pediatrician is going to be really, really important. And the earlier that you can support your child in supporting them with their language development and their communication development, of course, we know that early intervention makes a very big difference. So that will definitely help as well. So I always say to parents, I know there are long waiting lists, but please go ahead, see your pediatrician, get them on the waiting list. And then there are lots of charities that are out there, like the National Autistic Society, where you can go and get some free courses, free information. And then, of course, we have our book where we talk about different communication supports and even understanding if your child may be autistic, what those features may be.
Yes, so there are differences depending on where you live. And in the US, too, there may be long waiting lists. But the point is that if you have a concern, either that just your child isn't talking or that that they may have autism, you should definitely seek an early assessment, because the sooner you know what the problem is, the sooner we can begin working on it. Now, Auntie Donia mentioned the ADOS. The ADOS is the Autism Diagnostic Observation Scale, which is a gold standard measure for deciding whether or not a child has autism. And in recent years, there's a special module of this measure that's been developed to deal with toddlers who aren't yet talking. So this measure has really been shown to have good diagnostic accuracy. And the nice thing about it is it doesn't feel like a test. It's really more like a play session where the interviewer will offer certain play opportunities to the child, and we will observe how the child responds to those. So you shouldn't be worried that your child won't, quote, do well if they're given something like an ADOS, because they don't get a score. It's not like an IQ test. It's a determination that's made on the basis of a lot of different observations that go on during this assessment. So you definitely want to try to get at that detailed assessment. If you go to the pediatrician and express your concerns to the pediatrician, they may do some things in the office. For example, they might try to test the child's hearing, because one of the first questions that always comes up when a child isn't talking for any reason is whether he can hear. Because surely if they can't hear, then how are they going to learn to talk? They can't hear what they're supposed to be learning. So we always want to check that out first. A doctor may do that in his office by just using instruments that he has available, but we recommend that you take the child for a clinical audiology assessment. Audiology is the profession that deals exclusively with hearing. They are very experienced at testing very young children, and we think that that's a more accurate way of finding out whether or not the child can hear. Most of the time, the child hears fine, and that's not the problem. But if it is the problem, you certainly want to know about it, because there are very specific interventions we can do for children who can't hear. Now, what if the child can hear? What would the next step be, Auntie Donia?
I think if the child is hearing, and as you said, they're going to go through an ADOS assessment as well as the interview with the ADIR. As you said, Granny Rhea, it is observational, but what's really important too is within those observations, we're looking at meeting a certain threshold. So it may be that the child does respond to their name when their name's called, but when we do something, play with them to look to see if they've got joint attention, or where we're offering different choices to them and not reaching for them. The other area that we look at is actually their use of gestures. We look to see how many different gestures they have, because I think many parents are surprised to know that a neurotypical toddler will have many, many gestures, as well as a range of facial expressions that they will use and coordinate that with their gestures as well as their use of eye gaze, and that is all coordinated together. So when we're looking at observing what could be the potential features, we have to have a certain number of those present for the child to be above the threshold to therefore meet a diagnosis of autism. And of course, we also have to look at the developmental history of the child. Was there anything at birth that could have caused any kind of developmental delays? We look to see how the child slept. We look at feeding. We look at motor development as well. So we want to make sure that we have a full picture of the child, because although the interview or the play-based assessment takes usually 60 minutes, sometimes a little bit more, that's just a slice of time. So we want to make sure that we're really understanding how the child presents across multiple environments with different people, familiar adults as well as non-familiar adults, as well as with peers. How do they relate to other children?
And that's why the interview is so important, because, of course, we can't see all those things when we do an assessment. So we need to get information about them from the parent. So it really is important to get both an observational picture and a detailed discussion from the parent about the child's history and current behavior. So generally what's going to happen if you suspect that your child might have autism and your pediatrician agrees, is to go to one of these testing centers and have, as Auntie Donia suggested, a multidisciplinary assessment. It's not going to be just one person who's going to see your child. You'll probably have a psychologist. You'll probably have a speech language pathologist. You may have an occupational therapist involved, because we want to look at the child from several different perspectives. And as you're kind of shopping around for your assessment, you want to ask those questions. Will there be more than one person looking at my child? Now, one person may work with the child, but the other people may be watching. And we want to have that multidisciplinary perspective. So your child will go through this assessment. They may, your team, depending on their observations and their knowledge of the child's history, they may or may not decide to do the ADOS. And if they do the ADOS, that means that they're leaning in the direction of autism, and they want to make sure that they have as much information about it as they possibly can. If they decide not to do the ADOS, it may mean that they think your child is not showing too many autistic symptoms, and they're going to focus more on the language and play skills that the child has. So you should not assume that your child will get an ADOS. That's going to be based on the information that you give your team about your child's history and their current behavior. But eventually, you will get to a point with your team where they will try to explain to you which way they think your child is going and help you to understand what that means about their development. So, Auntie Donia, what are some of the things that they might hear from their team about their child? from the assessment?
Well, the team are going to feedback regarding what they've heard in the interview that may correspond to a diagnosis of autism or not, as well as what they would have observed. And I think this is really important in terms of us thinking about that differential diagnosis. What would be the difference between the child being a late talker versus them having a diagnosis of autism? And the main areas that we see the child does receive that diagnosis, particularly if they're a toddler, where we're not expecting that much neurotypical language, would be around their social communication skills. So we're going to see their play. They're not going to show as much pretend play. They may not play with toys symbolically. They may not be able to easily transition, move from one activity to a next. We may see some sensory differences. So twirling the fingers, or an interest in light, or an interest in different textures. We may not necessarily see the joint attention. We may not necessarily see a range of facial expressions, as well as the different uses of gestures. Whereas the child that is the late talker, we would actually often see all of those nonverbal communication skills, but we would not hear a range of vocalizations, the babbling, and if we do, it may be that they're limited or delayed in comparison. And the feedback meeting should be also an opportunity to better understand your child's strengths and their areas of need. And any assessment will also come with recommendations. So if they're here in the UK, it may be that we would be recommending that they then be put forth for an educational healthcare plan, which would ensure that they would receive services at the preschool level, perhaps having some one-to-one support as well as other supports that may be of benefit. For example, some children who are non-speaking may benefit from using pictures for communication or a voice output device. So we want to guide you to really ensure that when you're in this sort of post-assessment meeting, that you're using it as an opportunity to better understand your child's strengths, needs, and what you can do. Because as Granny Rhea and I always say, it's those small steps that we make at the beginning that really make the difference. And we know that simple isn't always easy, but it is those simple steps that can definitely assist and help. So Granny Rhea, what is it for this segment that makes us go, arr?
I'll tell you what it is for me, Auntie Donia. I don't know if any of you have ever heard this, but when I was in clinical practice many years ago, people always used to say, well, my child hasn't started talking yet. He's 2 years old, and I'm worried about him because his sister was talking at this age. But whenever I tell anybody else, they always say, oh, Einstein didn't talk till he was 4. Don't worry about it. He's just a late bloomer. If we wait till a child is 4, we've lost 2 years of time in which we might be stimulating and facilitating his growth. And we should never think that we just want to wait until 4. But I will add that even though that makes me go, it's also true that children do develop at different rates. And even if a child is only going to be a late talker, they can sometimes be a late talker for quite a while. And so they may catch up eventually. Now, we do know from research that even children who catch up eventually may continue to lag a little bit behind, if not measurably, but just a little bit, be a little bit less skilled at language than their peers. But nonetheless, many children who start out as late talkers, by the time they get to kindergarten, sound like normal kindergartners. So sometimes it's really hard to know when we should intervene. Now, for kids with autism, there's no question. If a child is diagnosed with autism at the age of 18 or 24 months, we don't wait a minute. We want to jump right in with the appropriate interventions. But for a child who's 18 to 24 or 30 months, who's not talking very much, maybe only saying 4 or 5 different words, we can afford to wait a little bit longer if the signs of autism are not there. We can help parents stimulate language growth at home, right, rather than going right into early intervention. We can wait another 3 or even 6 months and see how things develop before we would want to initiate intervention. So we can afford to take a little more time to do what I call watch and see. We're not just waiting. We're watching closely to see, is the child increasing in their amount of speech? Are they making more different sounds? If those things are happening, then we can afford to wait a little while longer. But if we wait 3 months and we see really no change at all in the way the child is vocalizing, then we really want to think about moving into intervention more quickly. So, like many things in this area, the answer is not always absolutely obvious. And sometimes we have to make some judgments. But in general, children who are identified as having autism between 18 and 24 months should start getting intervention immediately. Whereas those who are said to simply be late to start talking, I think we could take a somewhat more conservative watch and see approach in order to follow their progress before making that final decision. What do you think, Auntie Donia?
I agree with you completely, Granny Rhea. And similarly to you, something that does make me go is when people know that I sort of do diagnostic work and may say to me, well, you can't diagnose autism at 18 months. And we know that, of course, you can. And just as you shared, it's so important that if we can and do identify autism early, that the prognosis is actually a lot more positive. The child is less likely to develop other behaviors that are frustration. They're more likely to develop appropriate communication skills, not necessarily spoken communication, but at least a means of communication. And of course, it becomes a great support to the parents as well. So I think I always say to parents, if you're concerned, speak to someone and please do go ahead and seek the support that you then need. But just as you said to Granny Rhea, for those who are obviously more late talkers, then as you shared, the wait and see, and parents can stimulate, and that I think takes us on to our next topic.
Yes, it does, Auntie Donia. So what is our eating cake for breakfast topic today?
So it is, how can we support children's language learning, particularly when they're really little? And as you shared, Granny Rhea, when they're not necessarily needing to go and see a speech and language therapist or a speech and language pathologist, but what can parents do at home?
That's a great way to put it, Auntie Donia, because there's a lot parents can do at home, and they can do it in a playful, fun way. When we're talking about eating cake for breakfast, we always want to remember that what we mean is we're looking for ways to have fun with our super special kids. And a great way to have fun with a child who's not talking very much is to play with them with things that they like to do and to talk about what we're doing. We want to narrate the play that's going on. So if the child likes to run a car back and forth and say vroom vroom, then we want to say vroom go, vroom fast. The car's going fast. I like that car. It's a red car. It's a fast red car. So we want to provide lots of talk about what the child is doing, what the child is interested in, and introducing some key words and repeating those words, but only in a playful, fun way. And when the child gets tired of playing with the car, then we want to play with something else or take a rest and come back and try it later. What are some other ways we can eat cake for breakfast with our late talkers, Auntie Donia?
I think just as you shared, Granny Rhea, the importance of finding an activity that's of interest to the child, but we can also do it through different language learning routines as well. So bath time is a wonderful opportunity to use that for language learning. And we can, as you shared, comment. So, t-shirt off, step in the bath, splash, splash. And we want to make sure that we're using a variety of language. So we're not just using nouns or actions, but we're also using verbs. We're also using different adjectives to describe, like the water is warm, or that was a big splash. So commenting on what the children are doing through these routines, particularly if it's a routine that happens on a daily basis, means the child has multiple opportunities to hear that language and therefore learn it. So bath time, hand washing, meal times. And as you shared, Granny Rhea, the eating cake for breakfast is about things that are fun for you and your child. And so there are many things that we can do with toddlers that actually don't even involve physical toys. It could be that they like being thrown on the bed and kind of being bounced that way. It could be that they like being swung around. So we can do these different activities that also can have some kind of anticipation for them. So ready, steady, go. And then, they get a big bounce on the bed. We sometimes refer to those as people games, where we're not using a physical toy, but it's sort of we're the ones that are engaging with the child. Of course, songs, another wonderful way to use an interest, something that motivates the child that you enjoy doing too, dancing in the kitchen together. So many things that can be done. But I think really trying to be conscious about the times that you are teaching language. So really, I think thinking about if it's going to be bath time, what are some of the words that I'm going to focus on? And then, Granny Rhea, I think it's also important that we give a little bit of space and time so that if you do comment on what your child's doing, you also allow a little bit of silence so that they can initiate, so that they can copy, because that's what we're looking for. We're looking for reciprocal communication, so that back and forth, but as well as them imitating what we're doing.
Yeah, that's a great point, Auntie Donia. I'm glad you brought that up, because we do want to leave time for the child to take a turn. And we have to remember that some of our late talkers need a little more time than other children do. So you might want to pause for a little bit longer than you feel exactly comfortable with and wait and see if they do something. And if they do anything, you want to interpret that as if it were an intentional communicative act, because that teaches the child when and how he can respond. Remember that, and Auntie Donia talked before about gestures. And even if your child isn't talking, maybe the child's able to respond with gestures. So if you're doing songs, it's great to have finger plays that go along with the songs, like 1 little, 2 little, 3 little monkeys. And using the gestures, the child may be able to imitate the gestures sooner than he can imitate the words. And we want to give him an opportunity to do that. The other thing I wanted to mention that Auntie Donia brought up, which is very important, is that you don't have to be playing with the child to be teaching language or stimulating their language development. You can do it in the context of everyday routines that you're going to have to do anyway. You're going to have to give the kid a bath. You're going to have to get them dressed. You're going to have to give them lunch. And those opportunities are wonderful for facilitating language because they give you opportunities to repeat the same thing over and over again. So every time you put the child in the high chair, you might say, there you go, here's the table, here's your spoon. And saying the same thing over and over in the same context is going to facilitate the child's learning because he's got lots and lots of information to go on, lots and lots of repetitions. And don't forget to give him a chance to put in his turn. After you give him the spoon, you might say, do you want to say thank you? Thank you. If he doesn't say it, you say it for him. But the point is you want to give him a chance, and eventually, we hope, the child will start to respond. Now, this kind of interaction is going to be helpful for kids who are late talkers, but it's going to be helpful for the children with autism too, because children with autism learn language the same way everybody else does. They just need some different circumstances in which to learn it, and they need a lot more of it. And the same is true for our late talkers. They will learn language, but it's going to take them longer, and they're going to need more input. And that's what we're going to try to provide during these playful, fun, loving interactions around not only toys and games, but everyday routines.
That sounds wonderful, Granny Rhea. Thank you so much. So, Granny Rhea, it is that time of day.
Yay! Time for cake.
Time for cake.
Auntie Donia, a new cake shop a new bakery opened up in my neighborhood, and I was so excited yesterday because I had a chance to go in and try it. They make not only coffee, but hot chocolate. And they have this beautiful cake display case with all these gorgeous cakes that are made with strawberry mousse and raspberry tort. And oh, they all just look so appetizing. I couldn't decide which one to choose. And I'm so sorry that none of them were gluten free because you wouldn't have been.
That's okay. That's okay. So actually, it was my sister's birthday yesterday, and my niece and nephew bought me a gluten-free muffin, which was it's carrot date. So I have that. So yeah, nice, healthy, quote unquote, muffin to have. So that's my cake for today. Well, enjoy, Granny Rhea.
I did. You too. Take care, Granny Auntie Donia. Bye-bye.
Bye-bye.
The Let's Talk About Super Special Kids and Cake podcast would like to thank our composer, Marty Eisenberg, our audio editor, Brent Morton, and our audio engineer and director of cake-based operations, Keith Stryovi.